1 year into a global pandemic, there are many things that COVID-19 has taken away from us. Millions of lives have been lost around the world. Some survivors have been left to shoulder heavy health burdens. Families have been torn apart and social and economic order has been altered. For 53-year-old Ferdinand Mayiwa, a medical social psychologist, COVID-19 has taken away his sense of hearing, sense of smell, balance, and even taste. And as Dorcas Wangira reports, he hopes the Kenyan public can learn important lessons from his private pain.
Sense of smell, sense of taste. I have to be very careful. I cannot walk near the road where there are vehicles passing. If this thing will land in your house, it's when you will know that corona is real. It's a dangerous thing.
So we know that probably 30% or more of people who have symptomatic disease may continue to experience some symptoms. It is not very clear to us as yet why these symptoms persist.
For 53-year-old Ferdinand Mayiwa, father of 5, the sound of silence has become a constant rhythm in his life. He lost his sense of hearing late February this year. To communicate clearly with a healthcare worker who works as a medical social psychologist at the Pumwani Hospital and the University of Nairobi's HIV Center, we have to write down our questions so that he can read and respond. He's also mastering how to lip read so that he can understand what is being said to him. But it's not just the hearing.
I have 4 dilemmas: lack of sexual orientation, loss of hearing, loss of smell, and loss of taste. I only eat because the foods that I eat, I know how they taste. This one day the food got burnt and I'm just seated here. So by the time I was realizing, I saw smoke.
In June 2020, Ferdinand fell ill one evening after work. He experienced severe diarrhea. 3 days after, he had fatigue, joint pain, headache, but he didn't have any of the signs and symptoms that would indicate that he had contracted COVID-19. He wasn't coughing and he didn't have any fever. When he started to experience difficulty in breathing and struggled to walk to the stage before going to work, he had to seek emergency care. The doctors he sought attention from thought he was suffering from meningitis. He had a CT scan and more tests done. He was then asked to raise 12,000 shillings to test for COVID-19 since his insurance cover could not shoulder the cost. Later, on the 26th of June, Pumwani Hospital scheduled mass testing at the hospital. 3 days later, his worst fears were confirmed. He tested positive for COVID-19 and he had to be admitted at the Kenyatta University Teaching and Referral Hospital. He tested negative on 17th July and was later discharged. But instead of recovering, he fell ill again, necessitating more tests for pain in his chest. His chest x-ray was clear. However,
then I could not walk long distance. I could wobble, lose balance. Then I started developing difficulty in breathing.
On the 3rd of August, he had to test for COVID-19 again. He tested positive for the second time. Besides the loss of the senses, he was finding it difficult to lift heavy objects. Between October and November, he went to the COVID-19 clinic at the Kenyatta National Hospital. But even the doctors didn't have answers for his predicament.
Then they said that it's so strange because they are not understanding how this thing is happening. Then they told me that I can stop the pregabalin. It was for the nerves. I can stop it and see. But when I stopped it, things never changed. I go to work sometimes. You are walking, you are knocking people are abusing you. Oh, look at this drunkard here, they don't know.
He recalls the day he lost his hearing.
I was seated on this chair here and I was watching programs on TV. Then all of a sudden, I just felt, hey, is the TV shutting down because I had paid the Go TV? What's happening? But I can see the pictures, but I cannot hear the sound. So when I went to Kenyatta, Dr. Nyukuri, we could not communicate, so he writes, I read, I explain.
Dr. Lois Ombajo, the head of the Infectious Diseases Unit at KMH, says what is happening to Ferdinand is not strange. But COVID-19 still being a new disease, scientists and researchers are still trying to understand how the virus mutates, how it spreads, and why it causes mild disease in some people and severe in some.
People who have severe disease or have significant symptoms, even after they recover from the initial infection, some of those symptoms may persist. So you may find some of the commonest symptoms is fatigue, so just this feeling of tiredness. Not so much remnants of the COVID, it's just that the body responds differently. The body responds differently to the virus. So is it the virus that damages some things and that damage doesn't go away immediately? Is it the response of your body towards the virus that causes some damage that doesn't clear immediately? So those are things that we are yet to understand.
He's no longer productive enough to support his family. His wife, who works in a hair salon, has had to borrow heavily to shoulder his medical bills and provide for the family. He cannot afford the 4 tests he's required to undergo, including 2 MRIs, and also cannot afford a hearing aid. He needs to raise 130,000 Kenya shillings. His appointment is scheduled for the 25th of March. What he says saddens him the most is a lost connection with his family, the stigma and the alienation from family and friends. A support group for survivors is critical for him.
Sometimes the small boys, they want to pray, they want to sing, they like singing. Now I am just there telling them, now me I cannot hear, they feel so frustrated, they feel so discouraged. The other time, the other boy wrote down and told me that is God punishing you? Sometimes I don't want to go where my friends are because the way they will take it. I keep telling them that I can talk, yes. And this is, I'm suffering because since I got COVID-19, my life has never been stable.
New disease associated with a lot of fear and stigma, a lot of people may have significant trauma, which means supporting, offering mental health support, offering counseling even beyond the period of COVID. And this goes beyond just seeing a professional. It's a whole community thing.
From his personal pain, he hopes that Kenyans can learn an important public lesson, particularly those who will believe that the virus is real only if they personally know someone who is infected.
I did my work and I got the dilemma there and God will see me through. But people should be very careful with COVID-19. The third phase we are being told is here, my friend. If this thing lands on you, if this body could talk, people would open their eyes. People should stop politicizing COVID-19.
Dorcas Wangira, Citizen TV, Nairobi.